The 18th century saw tremendous advancements in the study of electricity.
People were fascinated with electricity in the late 1600s, early 1700s because their experiments with static electricity.
Celebrated American inventor Benjamin Franklin and many of his scientific contemporaries had come a long way in identifying, even channeling, the previously mysterious energy, but they still wondered how it could be best used to serve humanity.
Fortunately, there were those who saw a clear application for the use of electricity to serve their fellow man.
Researchers in Great Britain in the 1700s, they were fascinated by Ben Franklin's experiment, especially because they were interested in electrical therapy of people for therapeutic purposes. They started using those rubbing machines that generated static electricity and those Leyden jars to treat patients.
An English clergyman by the name of John Wesley emerged as one of the foremost pioneers in the therapeutic application of electricity.
In the 1700s, public demonstrations of electricity became all the rage. It was while attending just such a demonstration that Wesley, a driving force in the development of the Methodist Church, became excited by the healing potential of this natural energy, which he soon referred to as the elixir of life.
In the 1750s, Wesley obtained an electrical machine, determined to test its practical applications. He did so by using the machine on himself.
He applied it to himself, and when he saw that it would soothe him, that it would work on him, he started applying it to other people.
Wesley is said to have used the device to treat his own neuralgia, a painful nerve disorder. The relief was gradual, but eventually he claimed to have made a full recovery.
What excited John Wesley most was the potential of therapeutic electricity to be used as an inexpensive means of treating the poor. He criticised many of the doctors and apothecaries of the day for exclusively promoting prohibitively expensive drug therapies. As a result, he had electric shock machines installed in all of his free clinics. Although he advocated the use of electricity in conditions ranging from epilepsy to gout, he eventually came to believe that the application of electric shocks showed greatest promise for those suffering from nervous disorder.
Wesley had no traditional scientific research supporting his claims, but theorized that electricity acted as a stimulant to the system, improving the motion of fluids and flow of blood in the body. He believed the electrical current, properly modulated, could jolt the body back into proper function.
If the voltage is not very high, then maybe, and what these researchers found, is that may have some soothing properties, especially for certain types of patients.
The treatments advocated by Wesley never gained wide acceptance from the medical establishment of the day. He blamed their lack of enthusiasm on greed, claiming they would never embrace any treatment so easily accessible and inexpensive for fear of lost profits. In 1760, Wesley published a book chronicling the use of electric shock machines in his free clinics, called the Desideratum. He closed the book with a plea to anyone considering the benefits of this radical new approach for curing disease.
Let him for 2 or 3 weeks try it for himself, and then his own senses will show him whether it is a mere plaything, or the noblest medicine yet known in the world.
Even among non-believers, Wesley's work was generally recognized as being humanitarian in nature. He made it clear that when using electricity to heal, the treatment should be applied with moderation, and that excessive shocks could have the reverse effect, doing great harm to the human body. But despite his altruistic intentions, some have pinpointed the efforts of John Wesley as laying the groundwork for the darkest chapter in electricity-based medicine.
They didn't use anesthesia, and they didn't use muscle relaxants. Sometimes patients actually suffered broken bones.
While early applications of electricity to treat the sick may have lacked scientific credibility, many new applications became commonplace to conventional hospital settings during the 20th century.
Every week, millions of anxious viewers tune in to watch titillating traumas unfold on their favourite primetime hospital shows. While these life and death dramas are designed to make the audience's pulse pound, the situations they recreate are often rooted in medical reality.
590, engine 501. Medic 501's around. Engine box 590, truck 501, medic 501, engine responder, man down, 4 block crossing. Truck 501, medic 501 responding, 400 block.
One of the most familiar life-saving devices used to heighten the dramatic tension is the defibrillator.
Truck 501, medic 501, so you both en route. Got a 59-year-old male who appears to be unconscious.
All right, we're gonna shock. Everybody clear?
The human heart receives small electrical impulses from the body, causing it to beat. Sometimes this electrical activity becomes deranged, causing the heart to beat in an irregular fashion. The condition is called ventricular fibrillation, or VFib.
All right, we're in VFib. We're gonna shock. Everybody clear.
VFib constricts blood flow through the heart and can result in sudden cardiac death. The defibrillator is used to shock the heart back into a normalized rhythm.
In 1899, a pair of physiologists from the University of Geneva named Prévost and Botelli were the first to recognize that a large electrical stimulus could restore normal sinus rhythm to an irregularly beating heart. Almost 50 years later, a surgeon named Claude S. Beck was the first man to save a human life by directly applying such voltage during surgery. While Beck's effective but unsophisticated device could only be used during open chest procedures, defibrillators were later developed that could be used externally. These portable units are now a common fixture in hospitals and emergency vehicles alike. However, not all medicinal applications of electricity share such a distinguished history.
Charging.
The mere mention of electroshock therapy conjures up images of brutality verging on torture. While the practice has become more commonly referred to as electroconvulsive therapy, or ECT, it still has the power to send chills up our spines.
Electroconvulsive therapy is really the use of electricity to induce a seizure in the brain for a minimum of 15 seconds until the patient loses consciousness.
The seizure is thought to produce positive changes in brain chemistry, capable of alleviating the symptoms of certain mental disorders.
Electroconvulsive therapy is used most frequently with depression and with bipolar disorder.
Although convulsion therapy of this kind is most commonly associated with electric shock, this wasn't always the case.
Early use of seizures to treat mental illness was done through chemicals, not through electricity.
In the 1930s, a Hungarian physician named Ladislaus von Meduna was doing psychiatric research at an institute in Budapest. He theorized a so-called biological antagonism between schizophrenia and epilepsy. Building on that mistaken conclusion, von Meduna came to believe that inducing seizures might be one way of treating schizophrenics. He used intramuscular injections of camphor and metrazole to achieve this desired effect.
While von Meduna claimed that 50% of his patients experienced dramatic improvements, a significant percentage also suffered from spinal fractures due to the violent nature of the convulsions. An Italian psychiatrist named Ugo Ciletti believed that a safer method of inducing seizures to combat mental illness could be offered through the use of an electric shock.
This inspiration came to Ciletti after witnessing the calming effect experienced by hogs that had been jolted with 125 volts of electricity before being led to slaughter. The treatment proved to be more effective against mood disorders such as depression than battling schizophrenia. Still, the practice became widely accepted, and its use eventually began to spread.
ECT was widely used in the 40s and 50s, and then I think came into increasing criticism and distrust by the public in the 60s and 70s.
Counterculture author Ken Kesey's highly acclaimed novel One Flew Over the Cuckoo's Nest and the subsequent film of the same name starring Jack Nicholson played a large part in tainting the public's perception of ECT. Still, many of the concerns were completely valid.
When it was initially used, Really, it was sort of the dark ages of this kind of approach, and they used to use a bilateral ECT, which caused increased side effects around memory loss and confusion. They didn't use anesthesia, and they didn't use muscle relaxants. And sometimes patients undergoing ECT actually, because they were in a full convulsion and the electricity wasn't regulated in the way that it's regulated today, actually suffered broken bones.
More disturbing were reports that the treatment wasn't being used to help patients at all, but for something entirely more sinister.
Well, there were reports that ECT was used as punishment.
But the procedure has regained much of its respectability since falling from public favour. Anesthesia and muscle relaxants are now required for patients undergoing the procedure. Voltage levels are closely regulated, and doctors are forbidden to prescribe ECT without the patient's approval or the approval of a legal caregiver.
And then in the mid-1980s, the National Institute of Mental Health and the National Institutes of Health convened a consensus development conference, and that again revisited the issue of ECT. And what they found is that ECT, while being one of the most controversial treatments for people with mental illness, is also one of the most effective for those people with severe depression who have not responded to any other treatment modalities.
Despite these findings, uncertainties still surround the procedure. Some theorize that the seizures induced during ECT force the brain to release neurotransmitters that then improve the function of brain cells. But this is not a uniformly accepted scientific conclusion.
Although the interesting thing is about electroconvulsive therapy is that we really don't understand how it works. We know that it works for many individuals with severe mental illness, but we don't really understand the mechanism.
Some potential side effects include memory loss and the possibility of other cognitive impairments. However, proponents insist that a low percentage of patients are affected in this way.
I think what I want people to remember is, even though it doesn't work for everybody, it works very well for some people. I would be disappointed to see any attempts made to restrict access to a treatment that in fact has proven to be very effective for a very significant number of individuals.
Past misuses of electroconvulsive therapy may have been responsible for unnecessary suffering, but new applications for the therapeutic use of electricity could have the power to eliminate pain altogether.
TENS, which stands for transcutaneous electrical nerve stimulation. Anytime I'm stimulating a muscle, I'm stimulating a nerve, because the muscle doesn't move unless the nerve fires.